So can everybody hear me okay? Yes. Great. I'm going to start apologizing in advance for my voice because I'm probably going to be either losing it or coughing a lot because the pollen's trying to kill me. Just saying now. So Buddhism is, of course, an Eastern religion. A lot of people think of it as a philosophy, and it's absolutely okay to embrace it as a philosophy, as that's what you want to do. For many of us, though, it is a religion. And the Buddha himself was a great teacher. He was known as the first physician. And his practice was not that of curing of bodily ills, but of mental ills, right? So there's this idea that not Buddhism itself, but the practices of Buddhism can be used as complements to traditional psychotherapy and to traditional mental wellness treatments. So that's what I'll be talking about today. And if you guys have any questions afterwards, I did have to cut a lot of this for time so that you wouldn't be here for 2 hours. So I'll be happy to answer anything after the fact. So we had a visitor to our house not that long ago. And this visitor came to us in the form of a stray dog that my husband picked up at the park. And he said, "Oh, she followed me home." She was very old looking, she was scruffy, she was badly in need of a bath.
Can you speak into the mic?
Here we go.
Yeah.
Better? Okay. So she was in need of a bath, or 10. She smelled like she'd rolled around in something horrible like trash, then eaten it, vomited it back up, and rolled around in it again. So you can kind of get a picture of this dog. So we bathed her, and it took about 3 shampoos before the layers of dirt started kind of coming off. And they weren't the consistency of mud any longer. And she still smelled bad, still, after all that. She was missing teeth, she had infections in both eyes, and she was pretty badly infested with fleas. But she was also incredibly sweet, and she just wanted affection. And whenever we came near her, she'd jump up and greet us. And I loved this dog after having her for less than a day in my house. Unfortunately, I knew that we couldn't keep her because we have 2 dogs and they're very high maintenance, and I call them attention-seeking missiles. So she was just not going to get the kind of attention that she needed in our house. So we took a picture of her, we posted it to Facebook. We were looking for the owner, we were looking for a good home, and we got a lot of inquiries, but after learning that she'd become a project dog, a dog that was in need of attention and care and possibly, carrying unknown illnesses, a lot of people backed out or stopped returning our calls. And what was happening is they were looking for a cute little dog, and it was really hard to tell from her photo that she could be sick. Well, without realizing it, a lot of people treat other people the way that these people were treating this dog. Okay. We go through our lives, and we don't realize the impact that we'll have on other people. We tend to gravitate toward people who are vibrant and lively and healthy looking and attractive, but we turn our backs on the scruffy people of the world. Those people who are homeless, who are poor, who are sick, who are mentally ill, we lock them away, where we don't have to look at them, as if hiding them hides the fact of their existence. When you spend any amount of time cultivating the Brahma-Viharas are loving kindness, compassion, empathetic joy, that's being happy for others, and equanimity. You learn that you can no more turn your back on the scruffy people of the world than you can turn your back on your own suffering. We start to recognize in that point the true meaning of oneness. So what gives us hope is that there are people in the world who spend their lives tirelessly working to help those who can't help themselves, the people that society has chosen to forget. So just as these people exist, there was somebody who eventually took the scruffy dog. She went to a good home, and the couple who took her had already made arrangements for vet care, and it turned out she had a happy ending. She wasn't that old, she was microchipped, she was a purebred dog, and the only thing really wrong with her was that she was dirty and homeless. She didn't have any major health issues aside from the fleas and the eye infections. So she just needed a little TLC, and now she's thriving under the care of a new family, which is awesome, right? But it fills me with sadness that the people in our society who need this help, like this dog did, the mentally ill, the poor, the destitute, they don't have people working for them as often or as loudly or as hard as people will work for dogs or other animals. They're often cast aside like this dog was to begin with. Because there's so much stigma that still surrounds mental illness. Even in this is 2016, and there's still a stigma around mental illness. People fear seeking treatments. They won't tell their friends and their family, even if they do. My younger brother has schizophrenia. Okay? He's probably had this most of his life. He got diagnosed finally with it about maybe 5 years ago after a psychotic break. And he has suffered greatly because of this. He has attempted suicide. He's been Baker acted a few times. Even with all the medication he's on, he still has hallucinations. He still has days where the voices are telling him to do things that he doesn't want to do. So the last time he was Baker acted, he called me while he was waiting for them to come pick him up to take him to the hospital. And what he was afraid of, he wasn't afraid that he was going to the hospital. He wasn't afraid that he might hurt himself. He wasn't even afraid of, what might happen while he was in the hospital, whether he'd be forced to take medications that he didn't want to take. What he was afraid of was he was afraid that people would find out. How sad is that? That's heartbreaking for me. So this is an example of, what people with mental illness who have to live with mental illness have to go through every day. Now, there are two types of suffering. There's physical suffering and there's mental suffering. Physical suffering is suffering of the body, illness, old age, sickness, something that we all experience. Everyone experiences some type of physical suffering in their lives. No matter what your status, no matter what your class, you are going to experience physical suffering. Mental suffering is a little bit different. We all experience mental suffering differently. Some of us are more resilient than others. Some of us have chemical imbalances in our brains that force us to go through this suffering no matter what we do to stop it. When you have physical suffering, you can go to a doctor, and the doctor's going to give you medication. And that medication might not permanently fix you, but it will give you some relief. When you have mental suffering, because of the stigma, you can't tell anybody sometimes, or you're afraid to tell people. You're afraid of what people will think of you. You're afraid of being judged. You might go to a doctor, you might not. And if you do go to a doctor, maybe you'll get a diagnosis that will help you. Maybe you won't. The mental suffering in our minds can be caused by many things. They include disappointment, anger, hatred, frustration, fear, loneliness. Some of those are very easy to treat. Sometimes all you need to do is talk to somebody. Sometimes it's more involved and you need medication. Everyone will experience this differently, like I said. But the body and the mind, nama and rupa we call it in Buddhism, they coexist. They affect each other. So sometimes physical illness can cause mental anguish. Sometimes mental illness can cause physical pain. Even sometimes when the physical illnesses are resolved and are fixed, you still have that mental suffering that goes along with it, right? So the physical suffering and hardships of older generations who had to work very hard to survive and have been replaced by modern technology so that our generation doesn't have that kind of physical suffering anymore. So ostensibly we should be better equipped to handle our mental health, right? Our mental wellness. Unfortunately, mental illness in psychiatric patients are increasing these days. One of the interesting things about Buddhism is its pliability. When Buddhism moves from place to place, it takes on the aspects of where it goes. In India, it takes on aspects of Hinduism. In China, it takes on aspects of, Shin or Zen or whatever, Taoism. In Japan, it takes on aspects of Shinto. When it came to America, it took on aspects of psychotherapy. So this was kind of interesting. D.T. Suzuki came to the West, and when he brought Buddhism with him, it took on that form. It took on psychotherapy. And you can see in certain treatments nowadays that are very based in mindfulness, dialectical behavioral therapy, mindfulness-based stress reduction, mindfulness-based cognitive therapies. You can see the Buddhist influence there. And if you go back to the original Pali text to see what the Buddha actually taught, it's really easy to see that connection as well. The Buddha was talking mental health as soon as he emerged from the Bodhi tree. We call it religion, but it was really mental health. The Four Noble Truths deal with what? They deal with suffering. They deal with the cause of suffering. They deal with the cessation of suffering. And that suffering was mental suffering. That was what he was talking about. So he didn't use the language of psychotherapy, but he used the language of religion to couch it. That was fine. It's still the same teaching. The insight that came from the Buddha's enlightenment highlights the Buddhist approach to mental health. The insights that constitute the Buddha's first teaching offer a basis. It's been elaborated, it's been reformulated, it's been dissected in all these different ways, but the core teachings still remain the same. Life will contain suffering, and how you react to that suffering will depend on what the outcome of that suffering is. So the centrality of this really kind of remains, undoubted. Now, the Buddha's original concern with sufferings involved in human life became the focus of his teaching for the full 80 years of what he was teaching. In particular, they provide the core of the key teaching known as the Four Noble Truths. And those noble truths are specifically the noble truth of dukkha. Dukkha is affliction. It is a suffering that is born from how you react to your changing situation. Dukkha is associated with what you don't like, being changed, being taken away, what you like, being changed, being taken away. It is all about impermanence and how you react to impermanence. So in other words, human life is unavoidably linked to situations that are distressing. Now the Buddhist teachings and practical knowledge that come from the 2,500 years of study, they clearly have much to offer by way of guidance for those working in the field of mental health. The contribution's been recognized, and there's been a number of significant attempts to draw on Buddhist teachings and methodology in Western psychotherapeutic practice. So when you see your early Western theorists like Jung and Williams, what they were doing is they were pulling from Eastern theories and Eastern philosophies, specifically Buddhism. Some of them were based on some misunderstandings, some limited context, because they didn't have access to the teachers that we have today. But more recently, what we've been seeing is an influx of the techniques of meditation, mindfulness, and visualization, all being used as complementary therapies in counseling. In the last decade or two, as a more general interest in the interface between the psychological and spiritual has arisen, a number of Buddhist approaches have been introduced and taught to professionals working in the mental health fields. I know in my program, we actually have a course on mindfulness, just to use in counseling, the type of counseling techniques. So these approaches, even though they're all based on Buddhist practice and understanding, differ considerably from one another, just like all Buddhist practices do. This is because some rely more on Buddhist methodologies, such as meditation, while others focus more on theoretical understanding of mental processes, such as mindfulness. And they also draw their roots from different traditions and different Western schools of psychotherapy. So if you have, for example, someone who's an existential theorist who brings in Buddhism, they're going to be a lot different from someone who's a Jungian theorist and brings in Buddhism. And while there might not be a lot of time to explore in detail a lot of these therapies, and I don't want to keep you here for a couple hours, and I can answer questions about this afterwards, it is worth noting that some of the more widely used mainstream establishments have started using mindfulness in their research and in their practice. In particular, mindfulness-based programs have become really popular in the West. While in Japan, there's a practice called Naikan. Naikan is a gratitude practice, and that has been used pretty extensively in this prison system in Japan. It's starting to be used a lot more frequently here as well. The Trudeau Institute in Vermont has actually led the efforts to bring Naikan to America. Vipassana meditation, I'm sure a lot of you have heard of that. Those retreats are run by, or were run by a man named Goenka. Goenka recently passed away. But the Goenka movement have proved transformative for prisoners in India. There are retreat centers in Georgia that do multi-day, like 10-day retreats. They're completely silent and very intensive. And a lot of people have said that they've found that they are completely transformed by these retreats. Now there is dialectical behavioral therapy, and that's an eclectic approach that uses mindfulness with behavioral and analytical methods. It's been a success with problems that have resisted treatment, like borderline personality disorder, really hardcore kind of things that you can't fix with cognitive behavioral therapy, you can't fix with action-based therapies or acceptance and commitment therapies. But the problem with it is it's a long-term treatment. It can take 9 months or more. And unfortunately, the insurance situation in this country is really, really bad. And insurance will often only pay for 10 treatments in a year if you're lucky. If you're not lucky, it's 10 treatments in a lifetime. That's 10 sessions with one counselor in your entire life that insurance will cover. It's really, really, really bad right now, and it's one of the biggest causes of suffering for people with mental health conditions that can be treated with talk therapy. Now, someone who presents a simpler problem like anxiety, social anxiety, stress, those kinds of things that are really not super serious in terms of how they affect your life, those can be treated with cognitive behavior therapy. That's the more preferred method. Cognitive behavior therapy is really kind of interesting because it makes you examine your behavior and it allows you to change it because it makes you understand how you're thinking as you're doing these behaviors. So again, mindfulness of your behavior, right? So cognitive-based therapy or cognitive behavioral therapy is a shorter term solution, but it's still fairly lengthy. It can take 6 weeks or more. One of the mindfulness-based therapies, which is called MBCT, mindfulness-based cognitive therapy, uses mindfulness as a medium for the cognitive therapy method for spotting negative thoughts. So let's say that you have obsessive compulsive disorder, and one of your negative thoughts is that, oh gosh, if I don't flick this light switch on 6 or 7 times before I leave the house, something bad might happen. You recognize the thought you're having as you're flicking the light switch on, and that will start to change your behavior. It's actually also been shown to prevent relapse after recovery from depression. And that is severe depression, clinical depression, not feeling sad, not, I don't really feel like getting out of bed today, but clinical depression that you have been under therapy for and being treated for. Dialectical behavioral therapy is also used to treat addictions. Acceptance and commitment therapy, I think I mentioned earlier, that one draws really heavily from Eastern approaches to troubling thought patterns. From what I've seen and what I've reviewed in the research, it looks like it's more broadly accepted than dialectical behavioral therapy for a couple of reasons, one of which being that it's more short-term. But it's also more effective than both dialectical behavioral therapy and mindfulness-based cognitive therapy. Now, the way in which it's particularly more similar to Buddhist thought than the more established gold standard of cognitive behavior therapy is that while cognitive behavior therapy trains you to become aware of your thoughts and to directly challenge them, acceptance therapy encourages the recognition of these thoughts as transient and not you. And so it can be let go of. And that's one of the main teachings of Buddhism, right? Not I, not me. Because if it were me, I wouldn't be having these thoughts. If it were my body, my mind would be healthy and well, right? So that not you phenomena will allow you to sort of let go of all those thoughts. Now there's a concern among therapists and among practitioners that the word meditation will actually turn people off due to its association with Eastern religious practices. There is still a lot of sort of prejudice against Eastern religion, non-Abrahamic religions in this country. And so as a substitute for meditation, people tend to use the word mindfulness. You'll see mindfulness a lot. Mindfulness often is used synonymously with meditation in terms of counseling, clinical, mental health care, things like that. It's not always used synonymously with meditation. Mindfulness, in reality, just means being aware of what is happening here and now, right now. So right now, you're probably kind of feeling hot. You're listening to me drone on and on and on, falling asleep. So that's what's happening here and now. That is mindfulness. Mindfulness is being aware of what is happening in the present moment. But again, it's being used synonymously sometimes with meditation because people are afraid that if they say the word meditation, people won't come see them, because it might be bad. But MBSR, mindfulness-based stress reduction, has been based on Buddhist practices since it got started in the 1970s. Mindfulness-based stress reduction is actually kind of interesting because it was originally used on patients in Massachusetts that were going through pain management programs. And they were concerned that the stress of having this kind of chronic pain was affecting people's minds. And so John Kabat-Zinn and the University of Massachusetts came up with this program, Mindfulness-Based Stress Reduction. Mindfulness-based stress reduction incorporates not just Buddhist techniques, but talk therapy, yoga, and group therapy. And it is an 8-week program, so it's completely doable, and there are people certified throughout the country using this. You don't even have to go into a hospital, you don't have to go see a doctor. There are practitioners of MBSR that are just certified to do MBSR. They do an 8-week course, and you just go in and get your stress removed, which sounds great, doesn't it? Now, meditation doesn't have to belong to a particular religion. I mean, I know I said that people think of it as Eastern religion, but there are people in the Abrahamic religions who meditate as well. So meditation can be used by anyone at any time for any reason. Meditation, a lot of people have this idea that it means sitting down in a dark room with incense and candles, and you just empty your mind and just float. But what meditation actually is a lot of hard work. Meditation is about bringing your mind back to the here and now. There are 2 types of meditation, insight meditation and concentration meditation. And concentration meditation is what is usually used in these counseling programs, because concentration meditation forces you to be in the present. It forces you to be in your body. There's a body scan meditation that is used for people with a lot of pain issues, chronic pain issues. And a lot of people are resistant to this because nobody wants to experience their pain. They want to forget their pain. But by experiencing your pain, you can label it, you can see what it does, you can see how it feels, you can tell whether it goes away and comes back or whether it's a constant. You can recognize that pain is it's in this one area, and you think of it as you tell the story along with it, and it makes it worse and worse, right? So it's like the story that the Buddha told of the arrow. If you get shot with an arrow, it hurts, right? If you get shot with 2 arrows, it probably hurts twice as much, doesn't it? So the first arrow is the arrow that causes the suffering. It's the arrow of your pain. It's the arrow of somebody saying something to you that you didn't like. The second arrow is the story you tell yourself that goes along with that pain or goes along with whatever it is that you're experiencing that's causing you suffering. And you're taking that arrow and you're stabbing yourself with it over and over and over again as long as you're focusing on how bad the pain is and trying to push it away, right? So basically, you are suffering and you're miserable now. Suffering is going to be inevitable, but you don't have to be miserable too. So by focusing on that pain and concentrating it down to exactly what it is, and not labeling it good, not labeling it bad, but just accepting it for what it is, it doesn't make it go away, but it makes it a lot more tolerable. And that's just one of the ways that they're using mindfulness in pain management. The other thing that they're using mindfulness for, this is kind of interesting that we found out recently, is for PTSD. Now PTSD traditionally has had a lot of different types of therapies being used with it. There's cognitive behavior therapy, there's talk therapy, there's meditation, there's all kinds of things that have been being used. What we're finding though is that the complement of both talk therapy and mindfulness techniques are working in conjunction with each other better than one or the other alone. So PTSD, and especially in combat vets, and especially in female combat vets, is being used now through yoga, through meditation classes, and through mindfulness classes. So people with PTSD actually have hope. That mind-body connection again, that nama and rupa, are working together to get them out of that past trauma and bring them back to the future, or bring them back to the present. And so rather than avoiding their symptoms and rather than holding it all inside, they're able to release it. So what's exciting about all this for me is that people are really starting to explore what the possibilities are with mindfulness and with mental health. And by exploring it and by researching it, that means people are talking about it. And by talking about it, we can bring it into the light rather than having it hiding in darkness. So If you have any issues at all, whether it's anxiety, whether it's stress, something that doesn't necessarily require seeing a doctor or require medication, you can practice mindfulness to help reduce that. That's what all the research is saying. All of the research says this is a way that you can bring down your stress levels. You can bring down your anxiety levels. If you're having panic attacks and they're not preventing you from leaving the house, or they're not something that you really need to see a counselor about, you can take your breaths. You can do breathing meditations, and you can bring yourself back to your body, and that will reduce the problems you're having with panic attacks. So mindfulness isn't a cure-all for mental illness at all, by any stretch. It's definitely a complement to talk therapy. I always recommend when somebody comes to me with an issue that is not specifically spiritual that they go see a counselor first. Anything that you think is presenting a problem in your life, it's only a problem if it's interfering with your life. When it starts interfering with your life, you need to see a doctor right away. You need to see a counselor. And don't be afraid. Never be afraid. And never be embarrassed, because there is nothing wrong with that. Just like you wouldn't be embarrassed about going to see a doctor for the flu, you shouldn't be embarrassed about going to see a doctor for your mental illness. Okay? So I want to leave you with that today, and I want to thank you guys for listening to me.
Very good.
Thank you.